the future, and with health care is a right, not a privilege. Universal quality health care for all Americans.
CitizenNewscaster.com. You told me I don't have to be a loser.
What would it mean if the governor's budget was approved and the safety net eliminated? Eliminating CalWORKs means about 500,000 moms, U.S. citizens actively looking for work in this recession, and 1 million children would be cut off cold. Eliminating the AIDS Drug Assistance Program means 35,000 Californians will be cut off from medication for HIV/AIDS, and thousands more Californians will go untested, leading to potential new infections. Eliminating in-home supportive services for most recipients means 81,000 elderly and disabled Californians may be forced from their own homes and into more expensive state-funded nursing home care. Eliminating the Healthy Families program means 900,000 children will lose access to immunizations and preventative medicine, risking their health and the health of countless other children, as well as adding to the strain of the state's already overcrowded emergency rooms.
What are the 5 steps that Monroe talked to us about?
Eliminating Cal Grants for nearly 300,000 students slams the door of opportunity on middle-class Californians and robs the state's business community of the trained, educated workforce they need in the 21st century. Tell the governor these budget cuts are not just numbers, they are people's lives.
Thank all of you for joining us today. All of us are here today to support access to dental care for those in greatest need. We now face a very grim obstacle. The budget enacted by Governor Schwarzenegger and the legislature has eliminated Medi-Cal optional benefits. In the abstract, eliminating services of any kind sounds terrible, but going from the abstract to reality is part of the educational process today. We wanted to provide you with more detail about exactly what these cuts will mean to real people in our community. The Medi-Cal optional benefits identified for elimination include adult dental benefits, as well as chiropractic care, incontinence creams and washes, acupuncture, audiology, optometry, opticians, optical labs, podiatry, speech therapy, and psychology services. While the effects of these cuts clearly cross many medical service areas and needs, the largest component by far of these anticipated cuts includes adult Denti-Cal, eliminating care to some 2.8 million residents of California. And closer to home, the loss of Medi-Cal optional benefits will likely impact close to 20,000 adult Denti-Cal beneficiaries in Santa Cruz County alone, including the elderly, the disabled, low-income workers, and unemployed families. We're here today because we believe, as providers of and advocates for health care, we have a responsibility to educate the community and the public and policymakers about the very real impact that cuts to the adult dental services will mean in our community. With this in mind today, we are releasing a special report commissioned by OHAC, which is the Oral Health Access Council. This report is intended to educate the public and policymakers about the cost and consequences of eliminating adult Denti-Cal benefits. In short, the report concludes the following: that the elimination of the adult dental program will result in significant restrictions in access to cost-effective prevention care and early intervention, leading to poor oral health and poor general health, as well as significant short and long-term costs to the state budget and the state economy. To further discuss these key findings, the key findings from this report, I would now like to introduce Dr. Alana Thompson from Dientes Community Clinic, and I'd also like to remind you that we'd ask that you hold any questions that you might have for any of our speakers until all of them have made their comments today, at which time we'll allow for questions. So, Doctor, would you come forward? Thank you.
Good morning. My name is Dr. Alana Thompson, and I'm a dentist at Dientes Community Dental Care. And I just wanted to go over some of the information in the report and some of the impacts that these cuts are going to have on our state and on our community. Just to give you background, dental cal coverage right now includes diagnostic and preventative care. It includes emergency treatment for preventative for infection and pain, and regular treatment such as fillings, root canals, crowns, extractions, and well as removable appliances such as dentures. Some statistics from the report that was released. With the elimination of adult dental, an estimated 3 million Californians are going to lose access to dental care. It's both preventative and treatment. This in turn will negatively affect both the oral health and the general health of the individuals. As you've been hearing a lot lately in the media, a lot of research has been coming out linking poor oral health status with poor overall systemic health, both diabetes, cardiovascular, preterm, low birth weight babies. So not only are we looking at increased or decreased oral health status, but also decreased overall health of the low-income adult population in California. This is also going to lead to far greater costs as people are pushed out of preventative care. They let their dental disease go on farther, and then they end up having to have more expensive, costly treatment done later, often at higher costs if they end up at the hospital emergency rooms, where they generally end up having to get extractions as opposed to other more simple treatments that might have saved teeth, such as fillings or root canals and crowns. Also, in going to the emergency room, they can be quite expensive, and also often they're very ill-equipped to do much more than provide antibiotics, pain medication, and hopefully tooth extractions, but not always. The cuts are going to provide modest short-term state savings to the budget. By limiting the adult Denti-Cal program, we're going to see a savings of $109.3 million, which will reduce the state outlays, but will cause a loss of at least $134.5 million of federal matching funds. Also, major cuts to the Healthy Families program have been proposed, including the outright elimination of the program in order to close the $24 billion projected fiscal year 2009-2010 gap. If the Healthy Families program is cut entirely, over 6,300 children in Santa Cruz County will lose coverage, up to 20,000 in Monterey and 9,000 or more in Merced. In calendar year 2008, Dientes en Salud para la Gente treated 3,074 adult Medi-Cal patients with 11,514 visits. Combined, the dental visits accounted for over 25% of these programs. If the adult dental cals are limited, our clinics in this community stand to lose nearly $2 million in Medi-Cal reimbursement for healthcare services that our patients desperately need. Provider organizations such as Salud and Dientes will lay off dentists, dental assistants, front and back office staff, as well as ancillary support staff. Also, something to think about, the majority of our 4 dental schools get their patients through the Medi-Cal program, so a lot of the patients there are being seen because they have that coverage. If they're no longer able to be seen at the dental schools, those are patients that the student dentists cannot see, and so that will definitely negatively impact the education of future dentists and dental hygienists in the state of California. Governor and our state legislators must avoid short-sighted budget cuts to vital health care programs. These budget cuts will cost children, the elderly, disabled, and low-income families from their health coverage at a time when they need it most, and lead to higher public costs for delayed treatment and emergency room care. Thank you very much.
Thank you, Dr. Thompson. Now I'd like to welcome Dr. Dennis Spaliute, who is the Dental Director for Salud para la Gente, to further discuss the impact in our community of the proposed cuts, and also to provide information related to a lawsuit which has been filed by the California Primary Care Association. Welcome, Doctor.
Good morning, I'm Dennis Spaliute. I'm the Dental Director for Salud para la Gente, a federally qualified health center, just like Dientes, serving the underserved community of South Santa Cruz County. For one to say that dental oral health has no connection with physical health is really total ignorance. Chronic health conditions like diabetes and heart disease not only exhibit physical effects, but oral problems as well. Dental disease, when left untreated, could lead to more severe problems and even death. So reduction of critical medical services as adult dental makes things worse for a community with the greatest need for dental care. There will be a 40% reduction of revenues in community clinics statewide, and the clinics will report a total loss of $56 million for adult dental. As of July 1st, the resultant effects of this could mean loss of coverages and possible layoffs, more importantly, affecting the overall health of millions of Americans and increasing healthcare costs, longer wait times in community clinics and health centers. Aside from the elimination of dental services for adults, the Department of Healthcare Services could also reduce reimbursement rates to providers by 10%. So we urge our governor and the legislature to recognize the community's health care needs, including the children, the elderly, the disabled, and the low-income families, by fully restoring the Medi-Cal program and the Healthy Families program. On April 29, 2009, CPCA, along with co-petitioners Clínicas del Camino Real and Southern Trinity Health Services, filed a writ of mandate in the State Superior Court of Sacramento County. A writ of mandate is an order issued by a court to a statutory authority requiring them to do what they are legally required to do, or preventing them from doing something that they are not legally authorized to do. The writ contends that FQHCs, or federally qualified health centers, of which Salud para la Gente and Dientes belong to this kind of health center, and rural health centers, or RHCs, are exempt from cuts to dental, chiropractic, optometry, podiatry, and psychology services on the grounds that they are core services, according to state and federal laws, and orders the state must reimburse FQHCs and RHCs for these services. Consistent with federal law, California's definition of core services includes services of dentists, chiropractors, optometrists, podiatrists, and psychologists as FQHC providers. The suit further maintains that FQHC and RHC services are a mandatory Medicaid benefit, and California recognizes FQHC and RHC services as a mandatory Medicaid benefit. And tomorrow, Friday, is very significant, the 12th, because this should be the likely date for a decision to be made. If the court rules in favor of CPCA and its co-petitioners, FQHCs and RHCs will be able to continue to provide the services and receive reimbursement for these critical Medi-Cal benefits. However, if the court rules against CPCA and co-petitioners, over 250 clinics in California will lose approximately 40% of their revenue for providing dental services to low-income communities. Clinics will lose their sustainability, and Medi-Cal beneficiaries will not be the only individuals that will be losing their access to these services. Low-income children and also the uninsured will also no longer be able to access primary and preventative dental care. So what happens? It is the emergency rooms and hospitals that will now become major providers to dental care. Thank you.
Thank you, Dr. Baliut. Now I'd like to begin introducing our patient speakers. Our first speaker will be Maria Montesinos, a Dental patient who's received her care at the Dientes Community Clinic. Maria, would you like to come forward? Yes, thank you.
Hi everyone, my name is Yari Alvarado and I'm here to translate for Maria Montesinos.
Mi nombre es María Luisa Montesinos. Yo vengo a hablar aquí por lo mucho que me va a afectar el que me quiten el medical. Pues yo tengo 3 de familia, 3 niñas y yo y mi esposo. Solo me sentiría muy mal, me daría tristeza que me quitaran la ayuda porque yo realmente la necesito. entonces me afectaría muchísimo.
Okay, Maria just said she's here to represent our community, being that she's one of our Medi-Cal patients, and she's a parent of 3 children who are also under the Medi-Cal program. She would like to express her concerns as far as Medi-Cal being taken away from her as far as her dental needs. She is a patient of our office at Dientes. She's been there for quite a few years, receiving dental care for all herself and all her family.
Pues en la clínica Dientes me gusta mucho como la atención que nos dan ahí en la clínica. Solo yo pediría de favor, de todo corazón, que no nos quitaran la ayuda del medical, por favor.
She would like to say she is really concerned about Dental being taken away. She would like to say that she hopes for this not to be taken away. ¿Qué más quiere decir?
Pues como de yo y mi esposo, yo no trabajo, el único que trabaja es mi esposo, entonces a mí y a mi familia nos afectaría demasiado.
Okay, she's saying the only one who works in her family is her husband. He's the one that provides the money for them to support themselves, which is very little. This is a reason why she feels that, not receiving any dental care, not having any dental coverage through Medi-Cal would really impact their financial situation. Okay.
Bueno.
That's it. Thank you.
Muchas gracias.
Should I go?
Should we just, let me introduce you. As long as she's already up here, and thank you very much for providing the interpretation for Maria. Let me again introduce Yadi Alvarado, whose dental care has been covered under the Healthy Families Program, and she'll share some comments about her perspective. Yadi.
Thank you. Hi, everyone. Like I said, my name is Yadi Alvarado. I'm an employee also at Dientes Community Dental. I've been there for 5 years. I am a mother of 2 children who are a 1-year-old and a 3-year-old. Ever since they were born, they've been covered under the Healthy Families Program, which now that I've heard this is also proposed to get eliminated, it really concerns me just because I financially don't imagine myself being able to afford any type of private insurance. I mean, being the way our economic situation is right now, I just feel that it would really impact my personal financial situation. As a mother, it makes me really sad that once this is taken away, I'm really just going to have to probably limit myself to taking my children to the doctor only when they need it, only when they're sick, or probably I'm going to have to even think about it twice that, I'm not going to be able to afford going to the doctor, not even for just routine checkups, for regular dental checkups, which is also Dientes, who's been also providing their dental care ever since they were born. And I just really want to be here to represent all the families out there who might be affected by this. I just really want to express my concerns that this is really going to affect everybody who is under this program, especially our low-income people. I mean, working at Dientes, I hear this all the time. I hear how the parents are always expressing how they're just so worried about, not having enough money to pay for their dental needs for them and their children. And now I'm pretty much probably going to be one of them, because I'm not going to be able to take them to the doctors for their preventative care, such as vaccinations, routine checkups, and at their age, this is very important. So I would like to tell our community or encourage our parents out there to really fight for what our children deserve, which is really good health. So thank you.
Thank you very much. We are now ready to move on to the question and answer period of the meeting, and I'm here to facilitate that, not necessarily answer all of the questions, but I'd be happy to invite you to offer questions and then bring up the folks that need to answer them for you.
How do you respond to your critics who may be working, may be affluent, and may feel that their tax dollars are supporting people who are not working? What's your response?
Who would like to take that question?
As Executive Director for Dientes, I'll tell you, as an individual, I can tell you that in balancing our budget, it's really important to not only look at cuts that one can make, but look at new revenues. I think it's absolutely irresponsible for our state not to engage in expecting that there will be a mix. We have $24 billion, $24.3 billion of projected deficit. We need to cover that not just through cuts. And these are draconian cuts that are going to impact people's health and livelihood and wellness, and it may even result in death in some instances. That makes no sense when people can simply dip in a little deeper into their pockets. I can tell you I don't mind cutting deeper into mine. I'll tell you that personally. No problem doing it. I grew up completely poor. I was dependent on services like these, and I've come to a point in my own career where I can afford to help others, because this is how we foster a community, ultimately. So I would say if you're there and you're resistant to it, look a little deeper into the mirror and ask yourself, do you really need a new Mercedes? Do you need an extra couple $100s in the bank account when it could be a child's life? It could be the health of your neighbor. There's a lot more people who are losing jobs. I mean, let's have some compassion and not simply look at our bank accounts. I think that that's really critical for us to look at this problem not individually, but as an entire community. That's my personal take on the issue.
Hi, how are you? My name is Dr. Jose Chiviras. I'm an internal medicine physician and also medical director for Salud. And, you know, I'd really like to respond to that question. It really is a deep question. It's an ethical question, and it's a question about what we believe in this community, our community, as well as the United States, what's important. And, you know, we take a look at a deficit of, you know, $25, $30 billion. It's not insignificant in California. It really isn't insignificant. You know, but we don't have any problems at all spending $1 trillion in 5 years in Iraq or in Afghanistan. And so, you know, one plane, one B-2 bomber is probably $3 billion. And so you're asking about making choices, and I think everybody in this room would choose to have outstanding health care, which we should have. I mean, given the affluence of the United States and the resources that we have. And so for you to try and, you know, say that individuals in this country, or maybe some people would say, well, what would you choose? Well, certainly I wouldn't choose any more monies leaving this country to destroy other people's livelihoods, and now we're rebuilding the infrastructure of other countries. I would vote for, I think, what our council person said, and that's to support our children with preventative medicine, with access to dental health care, medical health care, and certainly give them, you know, an opportunity to be educated. And as President Kennedy said, education is the greatest equalizer.
Cutting programs, increasing the roles of the uninsured is not going to be felt only by people who are struggling and have no means to pay for the services. The costs of those care are going to be redistributed and shifted to the folks that you're referring to who have jobs and have coverage. So you're going to see higher premium costs, you're going to see jam-packed emergency rooms, and you're going to have effects that ripple to all members of the community. So it makes far more sense to invest in prevention and access so that we don't increase costs over the long run, and so that we don't all share higher burden to cover these the pain, the suffering, and reduce school days and reduce days at jobs and people who aren't prepared to go to work. It's something that we all share, and it's not just relegated to poor people.
I'd like to thank both Dientes and Salud para la Gente for their dental work in the community. It's very necessary, very needed, and I'm working as kind of a supplemental source that they send me patients. It's part of my way of giving back to the community because I feel I'm very fortunate, and I feel I'm happy to have a job, for one thing, and that I have a lot of patients that are laid off. And by working with the community in these two services and providing kind of another safety net for patients that fall through the cracks, it's very rewarding. We meet excellent people that come in. I'd like to encourage all the other dentists in the community to come on out and help out in a program like this.
I really like the question that you brought up. I hear it all the time. Why are we subsidizing these families and we have to pay all these additional tax dollars? This recession has brought upon a real good amount of scrutiny and well-deserved scrutiny. If you looked at the amount of monies that municipalities spend on frivolous programs, nowhere near this is nothing compared to how we have been spending without check and balances. Every municipality, and this community is one of them, okay? And every one of us that lives in any city in the state of California should look at their city council members, their assemblymen, and say, where else are we spending money of that is just frivolous? We read just recently, I think it was in the Chronicle, where we were spending, I don't know how many hundreds and thousands of dollars to renovate facilities, military facilities. And you compare that to the cost of taking care of children and families for dental care, it doesn't even match up. So I'm appalled when I hear somebody say, why should taxpayers support these families that don't want to work? Or why are we supporting these people that are in need? They need to help themselves. Well, you know, it's almost absurd to think. It's like saying we're spending $1 over here for this. Why should we spend this $1? And then we turn a blind eye right behind us and they're spending, $1 million.
Directly to your question, I would say go and ask any Australian citizen what the effect on wealthy is for taking care of the poor, because while I was there, I was able to treat many people within the public health care system. And yes, it has a lot of its flaws, and yes, the wealthy have to give to the poor. But the satisfaction that you get is more than anything else in terms of the finances that it is, and it trickles across the community. In terms of healthcare, of course, but you have people that are happier and then willing to provide their services back to the community. And so when you talk about twofold, I would say more like tenfold. If we give $1 today, and we expect that the wealthy take care of the poor, that's just a part of it. And the last point I want to make is we can't put a price on people's health, and that's the reason I returned home, because I wanted to come back to the community I was from and work in public health and try to provide assistance to our community members.
Thank you very much.
CitizenNewscaster.com.
You told me I don't have to be a loser.